Hey everyone, we have a wire warrior in our midst. And what I mean by that is for a disease that is more prevalent and deadlier than most cancers combined, poor circulation in the legs, known as peripheral artery disease. This doctor in Japan literally can tackle the toughest of blocked arteries. So much junk in your artery. Well, if it's 100% blocked, he's one of those that says he can pretty much cross anything with a wire. We're going to hear more from Dr. Naoki Hayakawa in just a moment. But first, Dr. John Phillips, my co-host, welcome.
Happy Saturday, Kym. How are you?
I'm doing great. Had some tough cases. Actually, we could have used Dr. Hayakawa this week because a woman had 100% blockages. She ended up being put on hospice because the doctor said, I'm not comfortable crossing those blockages, not calcified. It was thrombus, and said nothing can be done. And the woman gave up and didn't want to be transferred to another hospital for someone who said, actually, there is hope. There is a Dr. Hayakawa, um, duplicate over here in the area. But she didn't want to do it. And it was really sad. So
You
I'm
know,
really excited to talk to him and let
yeah,
patients know that it's
yep.
possible.
As am I. And the a couple of things. I had a great case yesterday. A gentleman had aneurysms in one of the vessels, so
Oh
the vessel was
no.
enlarged, young guy, 50, had basically thrombosed or full of clot all the way down to the foot, and we were able to. I've been using a lot of penumbra lately. Great device. We
That's a
sucked out the clot.
thrombectomy
Yeah,
device.
it's a
Yeah.
thrombectomy device, right? And got a nice result. But you never know how it's going to last, right? So we were done with the case, and then I saw him this morning, and he had a big grin on his face, and his foot was warm, and his pulses were what we call palpable. I could feel them, and he asked me if this was a success, and I said, I said, Brandon, every once in a while we get this right, and we got it right on you. It took us a long time, but we got it right. And I hope he has an issue with his medications. He needs to start taking them. So hopefully he'll start taking them. But I do want to. So the Japanese are known for their wire skills and the wire. So there's a bunch of companies out there that provide us with wires, Asahi, Terumo, and they make the best wires for us to cross these tough lesions. So I'm looking forward to speaking with Naoki, just because I love picking up tips and tricks. And to your point, if you we can pretty much fix anything if we can get a wire through it. But if you can't get a wire through it, you're done, at least from an endovascular standpoint. So I'm hoping to learn some things tonight.
Well, let's get things started with a moment of inspiration. Dun, da, da, da. Dr. John Phillips, spectacular vascular moment of inspiration.
I love the inflection there. That again, that is someone only an Emmy award winning journalist can do that inflection. Now, so I was thinking about people so getting through blockages, right? You need a tiny wire. It's a very small space and it's very cramped. And so I was thinking about I love history, and I've been reading a little bit about the World War I tunnelers. So these soldiers were kind of fighting a war beneath the war. They were doing these battles underground as in these tiny, tiny tunnels, and so a lot of them have in their diaries about how narrow the channels were, and that's really what we need to do, right? We've got to find a channel as narrow as it is, and crawl our way through it. So this is a quote from a French tunneler at a particular place, and he's quoted as saying, "We became moles of war, fighting not for the ground above, but for inches of earth below. Each crawl forward was a prayer that the roof would not that the roof would hold, and that the enemy picks would stay silent." These were warriors, underground warriors, who were trying to work their way through these tiny, tiny little tunnels, just like we have warriors in the CLI space to work
Yeah.
their way through these tiny tunnels of the arteries.
Yeah. Dr. Hayakawa, see,
Yeah.
Oh, you're a wire warrior. I
Hmm.
mean, I'm sure you can relate. It is like going through these thick, dark tunnels where you don't even know. I mean, you could poke the beehive and there could be a lot of clots that end up showering downstream. You just sometimes don't know what you're going to find when you go in there.
Uh, okay, okay. So sorry, and you please one more question. So I cannot
Yes.
hear. Yes.
So when you go into these arteries,
Mm,
it's like going into a dark tunnel with just inch by inch by inch
mm.
and kind of shoveling and pricking your way through, right?
Mm. Yeah. Yes, and we always fight against long CT chronic total occlusion, and organized by severe calcified region and many thrombus, organized thrombus. So, but fortunately, we have we have good guide wires in from Japan, and we always use Asahi or Sam Boston Scientific and Thermo companies guide wires, and we can use intravascular ultrasound. So we can watch the vessel as angiogram by angiogram and intravascular. So we can fight against CTO by both modalities and angiogram and intravascular ultrasound. Right.
Yeah. And I hear that you are amazing. You're like the number one, the top guy when it comes to getting through those 100% blockages with one of Reflow Medical's devices. That's how I heard about
Uh,
you. They're like, you wouldn't believe what this guy can get through. Like literally, I don't think there's any artery that stands a chance, any blockage that stands a
mm.
chance with,
No, no, no,
with him and
no, no.
that wire.
Of course, and sometimes we met very tough case, and we can not we experience a fail for guide wire failed case. However, over 90%, and we could get a success, technical success.
Well, coming up next, right here on the Heart of Innovation, we're going to hear more about what Dr. Hayakawa thinks about doctors telling patients that their vessels are too small to
Mm,
treat below the knee. I can't
mm.
imagine any other patients but his having the smallest vessels on the planet. So, that and more coming up next, right here on the Heart of Innovation on KDOW. Don't go away.
Yeah. Yeah, yeah, very small. Yeah, very small BTK in the BTK region. So we
Hold on
suffer.
one second.
Yeah.
I'm going to let Dr. Phillips, he'll bring us right back and
So,
then he'll get
Okay.
to you.
okay, I'll bring us back and let's geek out about your wires, man, because I love Asahi wires. I love the technology that the Japanese have. Okay. So
Yeah.
ready, three, two, one. Welcome back, everybody. We are continuing our conversation with Dr. Hayakawa, who is a endovascular specialist out of Japan near Tokyo, and loves, as do I, the equipment that the Japanese make with respect to guide wires and microcatheters. So if you could share with us a little bit, what is your specialty? Are you a cardiologist? Are you a radiologist or vascular surgeon? And how did you get interested in peripheral arterial disease, particularly working below the knee into those tiny, tiny little tibial arteries?
Yeah. Okay. 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 My turn.
Yes, thank you.
Yeah. Thank you very much, Dr. John. And it's written. No, my name is Kawan, and I am a cardiovascular interventionist. And in Japan, so the many as over 50 or 60% of the cardiovascular interventionists perform the endovascular procedure.
Okay.
Maybe the different from the other overseas countries, and several vascular surgeons have performed the vascular procedure, and radiologists and a few radiology IVR interventionists perform the endovascular treatment. However, we all in Japan, it's common to perform the cardiovascular interventionist for the peripheral and the coronary intervention.
So you started out your career in the heart.
Yeah.
What made you passionate about helping people with their leg blockages?
Yes. To improve the symptom dramatically. So if we perform the endovascular procedure and we succeed, if we succeed revascularization, the patient symptom dramatically improve. So this is our passion.
So
So
let me ask.
go ahead.
Oh, sorry, Kym. In Japan, as I understand it, surgery, at least in the like coronary bypass, is pretty rare. Okay.
Yeah.
And so because of that, you all have evolved the skills to treat a lot of blockages in the heart arteries that we in the US and other countries often send to bypass surgery. And correct me if I'm wrong, but it's my understanding that there's a religious component to this where people in Japan, they feel if their chest is open, they lose part of their soul. Is that accurate, or could you explain that to our listeners? Because I think that's very fascinating, and it also has allowed to the evolution of what you all do with respect to opening up these very narrowly blocked arteries.
Yeah. In Japan, there's too many hemodialysis and diabetes patients, so they have many risk of general surgery. So we tend to choose endovascular procedure.
Is there a religious component? Is there something against opening up the chest or opening up the legs?
Opening up trust.
Like physically
Doing-
cutting.
Yeah.
Yeah. But of course, some vascular surgeon and the cardiovascular surgeon perform the open surgery.
Okay.
Yeah.
But
But
as part of a
the penetration, the rate of surgery is now decreasing.
but it's interesting because you can get through really tough blockages and are willing to get through tough blockages. But here, there is still a large number of people that say it's not worth it. It's not durable enough. Can't do it. Not even going to try. But you go for it.
Yeah, but of course, we perform the guide wire crossing. However, the durability of the patency is very poor in the BTK region because of the small vessel size. So we sometimes need to switch the endovascular procedure to distal bypass or of course, and including the cardiovascular bypass surgery. You mean the of course I can perform I can treat almost all occluded region. However, we have only balloon for the BTK, so we cannot perform the long time patency. So that if we treat a big sorry, we need revascularization for the sufficient blood flow. Sometimes we need a distal bypass.
but it doesn't stop you from at least trying the first time to take a wire all the way down
Mm. Yeah,
into the
yeah.
foot. How far can
Mm.
you go with a wire?
Yeah. The below the ankle. Yeah, the two and metatarsal artery and pedal artery. Yeah.
I just heard that there are a couple doctors here in
Mm.
the United States that are doing what they call toe plasty. Have you
Mm.
heard of that?
Toe
What
plus,
do you
yeah.
go?
I
Can you get
yeah.
down to that?
Yeah, we sometimes we already published the finger artery, the ulnar artery and radial arteries interventions under the 1.5 millimeters vessel. We could treat by the good guide wire and intravascular sound.
Do you get a lot of patients with peripheral artery disease in their arm?
Sometimes very the penetration, the rate of the percentage is very few. But today I will treat very small finger arteries.
That's incredible. With
Yeah,
a wire and balloon.
yeah. Only wired balloon. The
Wow.
click.
Well,
Yeah,
coming up
that's
next,
yeah,
right here on the Heart of Innovation, I think,
yeah.
Dr. John, I want to expand a little bit more on that. And I think a lot of our patients are going to say, wait, what? What are the indications for that? So
Right.
that's next, right here on the Heart of Innovation. Don't go away.
All right.
Interesting.
It is, but I think Nakawa, you would the durability there is like weeks, maybe. I mean, like we can open that stuff up, it just never stays open. But I mean, in some instances, you do it to help perfuse a little bit, I would imagine. And I also believe that in Japan they have very high rates of hemodialysis, and so those folks, they are more prone to getting blockages in the arms, arteries, and the hands, and particularly then they often have fistulas too that can steal blood flow and things and cause problems. So the I think you had mentioned it's very difficult to have durable results in these arterial beds. We can balloon them, but they stay open for very short periods of time.
Yeah, it'll be. So can you start off with it?
Yeah.
And then we
Yep.
just, even if it's a second, just
Sure.
patients, want to know right here, who gets their fingers and how do you know if you need your fingers?
Yeah.
And then another
Very,
question came
very
in about,
niche.
and then we have another question that came in about the amputation rate in Japan compared to ours.
Oh, okay. That's good. Good. All right. We'll take us back. This is segment 3. It is
6 minutes, I think.
6 minutes. Okay. Ready.
Thanks,
Three, two,
Josh.
one. Welcome back, everybody. Thanks for joining us. Dr. Hayakawa, we are continuing the conversation. And before we went to break, we were just kind of scratching, no pun intended, the surface. We scratched with our fingers of possibly doing some procedures, opening up some blocked arteries in the wrist and maybe into the hand a little bit. We have those. I think it's important to note that we're able to do this. We have small balloons. Sapphire balloon, a very small, 1 millimeter. That's the smallest we have. Can make little channels. We open these arteries up to help get some blood flow. They don't stay open very long because, unfortunately, they're just very tiny. But can you share with us, like, why you would open up somebody's hand, an artery in the hand, or kind of getting into the palm or something along those lines?
Yes, thank you very much. And sometimes the hemodialysis patient and collagen disease patient have several problem of the hand ischemia, critical hand ischemia, gangrene and ischemic and cyanosis. So and the rest pain. So we sometimes treat for such kind of the symptom. and after the revascularization, the plastic surgeon performs a minor amputation of fingers.
And speaking of amputation, we have Becky that is asking a question online. She says, what is the amputation rate in
Mm,
Japan?
yeah.
And
Mm.
do you have a high rate of unnecessary amputations where doctors never even try, or do all doctors try before amputation?
Thank you very much. And in Japan, maybe the amputation rate is very rare, because we always perform the successful revascularization, and we solve the ischemic problem. However, unfortunately in Japan, too many hemodialysis patients, so they often suffer from the ischemic ganglion of the limb and the finger. Finger ischemia, critical finger ischemia is very rare, and the amputation rate is very low. But limb too, and
With the legs?
yeah, legs ischemia, and legs a minor amputation rate is relatively high in the high population in the hemodialysis patients.
Why is that? Are they just diagnosed too late, or do they seek
Yeah.
treatment too late, or is their situation, does it quickly become acute?
Yeah, they always have diabetes mellitus, so they tend to they don't mind their leg pain. So it's too late to aware the gangrene or ulcer. Uh, so it's a reason.
And are there efforts to try and improve the amputation rates in those types of patients?
Mm. Yeah, of course, and education, education for the patient is a most important thing. So we always perform the general presentation for the patient, and several clinics to know the lower limb disease patient, how to find and how to treat, and how to send the big cardiovascular center. So it's very important to educate to know the education.
Do all of your patients get put into a walking program? Do you have supervised exercise therapy
Yeah,
programs
yeah,
that are
mm,
required?
yes, yeah. And sometimes we perform the broadcast program. Yeah.
And do they have
Um,
to be in one of these programs for a certain amount of time before you will even try to open up the arteries?
yeah, yes.
And do most people participate? Do they follow these programs?
No. Some patients, only some patients.
Same here.
Mm,
We had Medicare numbers that show
mm.
only
Uh,
5%,
5%,
5%
5%.
of patients who are
Mm.
enrolled in a
Mm.
supervised exercise therapy program
Oh,
that's not in
yeah.
a study that actually finished the 36
Mm.
sessions. Well,
Mm.
coming up next, right here on the Heart of Innovation, we will have more with Dr.
Mm.
Hayakawa. And of course,
Mm.
we're going to talk about those below the knee arteries that so many doctors here say, it's not worth treating. We can't do it. We're just going to amputate, walk until you can't walk anymore, and then we'll take your leg. That's next, right here on the Heart of Innovation. Don't go away. Okay,
All right.
so we're
Section
in.
we're in segment 4. Okay.
We got lots of people, so shout out to everyone watching online. We have quite a few people watching online. Of course, if you have any questions for Dr. Hayakawa, make sure you put them in our chat. and we'll get to them. We are monitoring the chat, so make sure that you do put them in.
So, Dr. Hayakawa, I'd love for you and I to geek out here a little bit because if you don't mind, when we go live or record, if you, I'm going to ask you like, what are your go-to wires for below the knee,
Mm.
and your support catheters or whatnot? Because I'm always curious. I'm always trying to learn like what are we doing? If that's okay, is that cool? Good.
Yeah, yeah.
Okay.
Good.
Good. All right. 3, 2, 1. Welcome back, everybody. Thanks for joining us. We are continuing our conversation with one of my new Japanese colleagues, Dr. Hayakawa, near Tokyo, endovascular specialist, interventional cardiologist by training. So during the break, we were just chatting, and I love to pick your brain. So me personally, when I'm working on these small vessels, my kind of go-to wire, the wire that I choose first, is often a command wire from Abbott. I love that wire. What is your go-to wire? What is, if you were stranded on an island and only had one wire to work with the rest of your life, what would that wire be?
Thank you very much. Thank you very much, John. For me, as a Gradius guide wire by Asahi is the best guide wire for me. So
Everybody,
always
lo-
have a
everybody
yes,
loves a Gladius.
yeah.
Now, because you're in Japan, do you
Mm,
get so if we could just kind of share with the audience, so the wires that we have
mm,
certain what we call gram tip strength, so
mm,
their ability to penetrate, like how firm
mm.
they are, right?
Yeah.
Um, we have 40 gram, like the stiffest wire that I
Mm,
that I
mm,
know of, I think,
mm.
from Asahi,
Yeah.
is
Not
40 grams.
yes,
Now,
yes.
I was told in Japan you have 100 grams. So these are like
Yeah.
spears. Is that true?
Yeah. Yeah, that's true. And
100 grams.
we have the 100 grams the Jupiter series, Jupiter Max, and 100-gram tip load. And
Tupelo,
however,
yes.
nowadays, Asahi make a new hardest guide wire, the 60 gram, but the penetration force is stronger than from 100 gram. So the cross-read series, cross-read penetration, the 14 cross-read and the 18 cross-read has a much more tip load. And so we prefer to use the cross-read series, cross-read penetration series for the calcified occluded region.
Yeah. So imagine, Kim, like we're in the artery and we can kind of poke around at the blockage and you can kind of feel if it's really calcified or hard or if it's a little bit softer. And so the harder it is, the more force we need. So we use these larger gram tip wires. And so when you've got something that's 100 gram tip, that's like a spear basically, and you have to have very fine finesse skills because if you just push that thing, it's going to go out the artery, and
Yeah.
you're not going
Deflect
to
and
you're not going to achieve
perforate.
what
Yeah.
you want. So I love it. I love the 100 gram. Maybe you could send me some. That'd be fun to play with.
Yeah. Yeah, it's been sometimes very dangerous
Hmm.
for the 100 gram and the 60 gram guide wires, the risk of the out of the vessel. However, the very small, very short length and with the calcified region, we can
Hmm.
see the vessel course. So we can use the hard guide wire. If we use the hard guide wire for the standard CTO region, so we use the intravascular ultrasound guided or the duplex ultrasound guided wiring. So
Now,
image.
do
Yeah.
you do the ultrasound yourself, or do you have a technician that's with you in
Uh,
the procedure that's kind of helping guide you with the probe?
yeah. Very nice question.
It's
Uh,
external.
extra, and sometimes my
We do
friends,
IVUS.
yeah, my friends perform the extravascular by himself. However, we usually the technician performs the duplex echo.
Okay. Can you share a case with us? One of the toughest cases, because I hear literally there is nothing you can't cross. I'd love to hear what your threshold is, where you have said really can't do it, but also share a case where most other people couldn't do it, but you did, especially below the knee.
Yeah. Yeah, we sometimes experience a very tough case for the below the knee and below the ankle, totally occluded from the proximal to distally. Fortunately, we perform the nowadays intravascular ultrasound guided wiring, so we can watch the very small, tiny vessel from the intravascular.
Wow. Clear down into the pedal plantar loop.
Yeah, pedal plantar loop and including the metatarsal artery and the digital several digital arteries. But we can nowadays and intravascular ultrasound the imaging quality is very high, so we can watch the very small and in under the 2 millimeters and near the 1.5 millimeters vessel we can find, we can watch. So we can perform the intravascular ultrasound.
And we have a question that's coming in. What does this mean, 60 grams
Mm.
versus 100 grams
Mm.
for the wire?
The tip load is 100 gram is the strongest, but sharpened on the tapered, the 60 gram with tapered guide wire is the highest penetration force. So I prefer to use a 60 gram tapered guide wire.
Yeah, just so imagine like if my fingertip here is the wire and this is the blockage. So if my finger pushes and there's a way to measure the force that in grams, if my finger pushes here, you know, this is whatever 5 grams, or if it buckles, it's 2 grams, and if it just stabs right through it, it's 50, whatever. And so it's the ability to penetrate, and that's that we when we know that, we know how stiff the wire is, and it helps guide us based on what type of blockage we're looking at, how much calcium, how much soft plaque, things of that nature. But the bigger the number, the stiffer it is. Okay, so imagine like a 1 gram is a wet noodle, and a 60 gram is a coat hanger. That's kind of how I describe it to people.
And I want to just clarify for some of the folks watching, quite a few watching online,
How many
especially
watching
patients.
online?
We've had about 20 to 30 of them. So
Fantastic.
it's just bouncing around, and I can see
Love
them
it.
there across Facebook and Twitter and YouTube. And we have our amazing producer, Josh, that's monitoring that as well.
Wait,
But
what's the YouTube channel?
youtube.com/, the @ the way to my heart. But they're wondering about why do we care about this wire warrior in Japan? Why are we making a big deal about wires? And I know you mentioned it earlier, but Naoki, Dr. Hayakawa, why are these wire skills so important?
Yes, thank you very much. The guide wire, I think the CTO intervention, the guide wire crossing is the most important factor, I think. So the guide wire, of course, the guide wire crossing is very important. And where the guide wire cross, so the interluminal or subintimal. So this is the second important thing. So we always perform we try interluminal, interplug and interluminal
Inside the
crossing.
vessel, yeah.
Yes, inside vessel is very important. So sometimes perform the knuckle, big loop wiring that tend to go the subintimal, but patency and crossing success rate is lower. So we have to
Going through the vessel
yeah,
wall.
yeah,
Subintimal is
vessel.
they start out inside the vessel. It's considered true lumen. But
Yeah,
if they can't
yeah.
get through the main vessel, sometimes they can go into the vessel wall known as subintimal, right? To try and navigate around a blockage.
Yeah.
Well,
So
coming up next, right here on the Heart of Innovation, we'll hear more from Dr. Hayakawa and also Dr. Phillips. So stay with us. Don't go away.
yeah.
And Dr. Phillips, if you can kind of start that and just also say, like, before the break, we were talking about the importance of wire skills, because if you can't get a wire through, the balloons can't go through, the stents can't be placed, that kind of thing.
Yeah.
And
Yep.
I'll let you guys kind of wrap.
This is it, right? 4 minutes?
4 minutes.
4 minutes. Okay. So we've got, this is a short segment here. Okay, ready? 3, 2, 1. Welcome back, everybody. Thanks for joining us. Continuing our conversation across the Pacific Ocean to Japan with a newfound friend, Dr. Hayakawa. So before we went to break, I think it's important to really reiterate the importance of when we do these procedures, minimally invasive through what we call endovascular, you need a wire. Everything works over a wire. And if you can't get a wire across that blockage, you are not doing anything. That procedure is not going to happen. And so we put a lot of stock and effort and trust in the wires that we use. The Japanese make fantastic wires that we both use. You and I both use. So I guess share with us in the last couple of minutes, how do you work with industry over there in Japan to develop new wires? I mean, what are you guys working on now? If you can share anything, I think that'd be kind of fun to hear.
Yeah, you mean the industry?
Yes,
why you,
yes, yes. Yep.
yeah. The Japanese guide wires we have many guide wires industry. So companies sorry, your question is how many companies?
Well, just like, do you work with the companies over there and say, hey, I need a wire to do this. Let's work together and develop it. Or do they just come to you?
Yes. Thank you. Okay, so of course we try to advance guide wire technique with many companies with Asahi Intech and for instance Asahi Intech and the Thermo company we collaborate with to make a new good guide wire, new good microcatheter from our clinical experience, and they hear our voice, our experience, so they make a new device and improving the product.
Fantastic.
Is there anything else aside from wires that the Japanese vascular industry is working on right now that could improve care across the globe for PAD?
Yeah. Yes, the Japanese market, the guide wires, they make many guide wires now.
Do they have balloons and stents and have
Yeah, at
they
the same,
do?
yeah, almost same and a balloon and my catheter. But a stent is very few because drug-coated balloon is now dramatically increasing now. So the Japanese company make many drug-coated balloon in the coronary and peripheral.
Is there one wish that
Hmm.
you have right now for something not available that would make a difference for you in caring for your patients?
Yeah. Just sometimes sorry, the different mm, it's
Is there
different.
it's a good question. Is there a tool that you wish was developed, you wish you had in your hands? But
Yes.
what don't you have that you wish that you had?
Yeah. It, sorry, yeah, it's a difficult question, but
Do you
yes.
do you need more gram tip wires? Do you need something that's
Yeah.
or is 100 good?
More
100 is
stiff,
good.
more
Stiffer?
stiffer.
Stiffer. Gotcha.
Yeah.
Yeah.
Like like a plasma wire, the wire with electric.
Yeah,
Yeah.
yes, exactly. A cautery.
Yeah.
One more question for
Mm.
you. Tell us just about compliance of your patients.
Mm.
Is there a message for your patients out
Mm.
there and you want to say, come on, you got to do this? What is the number one thing you want patients to know, what you want patients to do?
Yeah, thank you very much. Very important. And they know they have to aware that their own symptom, and if they have any symptom, please come quickly.
Yes.
Come quickly. That
Come
is the
quickly.
best
That's
advice
easy.
ever. If you have any risk factors, if you have diabetes, if you've ever smoked, if
Mm,
you have autoimmune conditions, if you're
yeah,
even over 60, make sure that you do get your legs checked. If you're struggling with walking, if you can't walk as far as you could a year ago and at the same pace, ask your doctor for a leg artery ultrasound. Thank you so much, Dr. Naoki
yeah.
Hayakawa, for all you do to save life and limb for patients there, but also your influence on doctors across the globe, helping so many more learn how to improve their wire skills and become wire warriors like you.
Thank you.
Thank you very
Thank
much.
you.